Real beauty, everyone's going to say that it comes from within, and I don't disagree, but I think it comes from having a balance in the body, in the mind, and in the spirit. So I truly, as naturopathic doctors, we were just ingrained to understand that philosophy. The body, the mind, and the spirit have to be in balance to really have beauty, inside and outside. If you're not feeling good inside, you're not going to present it well on the outside. If you're not feeling good on the outside, you're going to have some probably harm inside. If you're not in your full realm of understanding whatever faith and belief and higher spirit for you, you're going to feel probably a little bit more insecure. So I think beauty comes from having that balance of the body, the mind, and the spirit.
Welcome to the Woman's Doctor podcast, helping empower women to embrace their body and soul's full potential. I'm your host, Dr. Trevor Cates, and after 22 years of working with patients, I found the answers to our health struggles are much deeper than most people realize. To help explore this, I'm interviewing colleagues and other wellness experts to get to the root cause so women can realize their true beauty and be informed decision makers for themselves and their loved ones. Often women feel like they're alone in their struggles. So often in my clinical practice, women have said things to me after sharing their symptoms and concerns, things like, Dr. Cates, I'm sorry, I'm such a mess. I'm probably the worst story you've ever heard. I was surprised how commonly I heard things like this, but I realized that many women have kept their health problems to themselves or had very little time to share their stories in a doctor's appointment. Let me tell you right now, you're not alone. If you're listening to this and you're struggling with issues like infertility, PCOS, period problems, night sweats, hair loss, and skin problems, you're not alone in your struggles, and there are solutions. In today's podcast, I'm sharing part of an interview I did for the Hormones, Health, and Harmony docuseries to help illustrate how challenging women's health issues can be while you're going through it, but how there is hope. My guest is Dr. AnnAlisa Behling, who is a licensed naturopathic physician with a focus on women's health. She attended naturopathic medical school with me back in the late 1990s and has been doing research, speaking, and seeing patients since that time. I enjoyed reconnecting with her when I recorded the interview for the Hormones, Health, and Harmony docuseries. Much of her personal story and how she helped herself and many other women overcome health issues ranging from infertility and PCOS to perimenopausal symptoms and low self-esteem. Much of that did not make it into the docuseries, so we're sharing it today in the Woman's Doctor podcast. Dr. AnnAlisa is very courageous, authentic, and knowledgeable, so I hope you enjoy her interview. Do you have your own story of struggles with hormones?
Yes, absolutely. I think all women probably struggle at one time or more in their lives. I mean, sometimes more often. I was diagnosed with polycystic ovarian syndrome, PCOS, at an early age, and conventional medicine just didn't really know what to do with me. I was a super competitive athlete. I had higher testosterone levels than an average man. And I was, solid muscle. I was a dual varsity athlete at Duke University. So had kind of crazy hormones with my PCOS that led to a lot of infertility issues that I didn't really necessarily care about because I wasn't trying to have children. But when I got married at 44 and thought about the idea of having a child with someone that I love, we considered the idea of what we would have to do to create a balance in my body to have a child with the knowledge that I was considered kind of infertile. I ended up doing a lot of research. I was actually lecturing for a company and did a lot of research on methylation. And sometimes when you don't have good methylation in the body, you don't produce enough of your own natural hormones. And it happens to be when you have improper methylation, you actually can be infertile as well. by the nature of me learning more about methylation, I started doing methylating properties. I was taking something called dimethylglycine, which must have helped my hormones because before we even could try to be pregnant or get pregnant, we found out I was 3 months pregnant, and I thought I was going through perimenopause because I was 45 years old, and it was such an interesting story because I went to another doctor, and she's like, "Oh, you probably are pregnant, not perimenopause." I'm like, "There's no chance. There's no chance." And when we actually did an ultrasound, she's like, "Oh no, you're not just newly pregnant. You're 3 months pregnant." And I still was having cycles, and I had lost weight, and I was like never healthier in my life. So I do feel like I owe that to, figuring out methylation and working with. I wasn't even necessarily trying yet to work with my own hormones, but it just naturally worked out that, at 45 years old, 45 and a half, had a baby and super healthy. It's great.
Can you explain what methylation is?
When I started understanding about methylation, what methylation did for our bodies, that became such a impetus for me to start thinking about my own health and my own hormones. The process of methylation happens in every single cell of our body. It is the process that helps us detoxify. It helps us create hormones. It helps us create neurotransmitters. That term, some people know the term glutathione, which is a really highly used antioxidant. That's the end product of methylation is glutathione, as well as all these other hormone productions. It helps even to, helps liver convert the hormones as well. So the methylation process is pretty darn important to hormones. And so there are many women who are either they don't methylate as well, or they even have genetic SNPs that don't allow them to methylate well. And there are testings that you can do. There's different labs that offer methylation pathway testing, and that's great for people that want to go that way. You also can just, I'm a naturopathic physician, so sometimes we use food as medicine to help with methylation, and we also use supplements like the dimethylglycine or trimethylglycine, which are methyl donors that actually help that methylation pathway.
What is normal or healthy for women's cycles?
It's subjective, right? What is normal to you? What is normal to me? I work with patient-centered medicine, so there is no real one normal. It's what's normal, what's best, what's optimized for that person, right? For that woman. So I grew up even with PCOS. I never had cramps. I never had irritability. I might have cried right before my period, and that was considered you're moody, right? So yes, we always hear the terms like, oh, you're bitchy, before your period, or you're moody, or, you get too sensitive, right? That's the word. You're so sensitive. And that can be true, and that could be the person's norm, but maybe that's just because how they're cycling. Maybe they aren't optimized in their balance of hormones. Maybe they need some modulation and adaptation in that hormonal balance of their cycle. I mean, a lot of women go through life never, ever talking to their doctors about their feelings of PMS or mood changes because they feel like that should be the norm, or that is the norm, or, they grew up from when they started having periods at 14 to 20, and the heavy bleeding and the cramps, and their friends have the same thing though. So they're like, oh, that's normal, right? So that's what I'm saying. Normal is subjective, and you just have to figure out what's best for you though. If that normal isn't good for you, then you need to come find someone who can help you.
What is your favorite hormone?
I would say that growing up, I thought that the epitome of, feminine was estrogen. But then when I found out that I had such a disbalance and an imbalance in my testosterone levels that was creating such a change in my estrogens, I embraced it. I said, you know what? I'm going to be proud of the fact that I have all this testosterone. I mean, I was lifting over 200 pounds in weights. I had 3% body fat. It was like, I was a huge athlete, super competitive athlete, and I embraced it. But I would say that in my life now as a physician, the fact that all of the hormones to me have to be in a balance. Otherwise, you're not in a balance. You're not in a hormonal balance. You're in a, dysregulation. So my favorite supplement that helps with hormones is that dimethylglycine or the trimethylglycine. So I kind of don't have one favorite hormone anymore. I have a hormone pathway that, that methylation pathway is what I really would say is my favorite thing to help people with.
Are women more commonly misdiagnosed than men?
I would actually say that many women are not diagnosed at all, not even just misdiagnosed, but really good testing is hard to find for some people. And I feel that even, let's talk about another hormone, thyroid. many physicians, conventional medicine, only test for TSH or T4. And in our world, in the naturopathic world and functional medicine world, integrative medicine world, we're looking at the bigger picture of how in all of the hormones, the thyroid T3 is converted from T4, and how TSH works in the actual gland. And so we don't just, misdiagnosed is actually, I wouldn't say misdiagnosed, I would say just not well diagnosed. You have to do proper testing to actually be diagnosed, right? And so if people are just not doing the proper testing or doing a full range of testing, then you're not going to have a diagnosis. So, I would think that with testosterone with men, it might be a little bit easier. They're doing free testosterone, it might be a little bit easier. But even for my men, I'm testing their progesterone, I'm testing their estrogen, I'm testing all their thyroids. I'm going to make sure that they're balanced in all of those hormones too.
How are hormones and our microbiome connected?
Clearly, that does change your hormones, but I breastfed for 2 more years after that. So not only were my hormones changing, but my microbiome was changing because I was obviously delivering a lot of nutrients to a newborn baby. So after my 2 years of breastfeeding, I ended up losing a lot of hair, basically diagnosed with an autoimmune disease called alopecia areata. I have a gray streak that some people think is beautiful, but that came from a loss of hair the size of my palm. I still have a bald patch in the front of my head, and I had bald patches all through my hair. And so as a woman, we get disappointed, right? We think our hair, our face, that's our beauty mark. So especially I had long, gorgeous, long hair. So that was hard. But that was all about people like, oh, that's just your hormones. You breastfed, you had a baby at 45. I luckily, being a doctor, I said, it's not just my hormones. I checked my hormones. It's not my hormones alone. And what it was my gut. I had a loss of, there's commensal, meaning they live together in harmony. So I didn't have harmonious gut flora. I had a lack of akkermansia. I had other issues where I wasn't producing enough of my bifidobacters. And there's just so many different qualities of the microbiome that have to interplay together. And sometimes when they don't, you end up with autoimmune diseases or imbalances in your hormones. And a lot of people don't understand that. They think, why are you checking? I have a skin disease. I have a issue with something else. Why are you checking my gut? I'm like, well, you'll see after I show you the results, you will see that the gut is why you have these issues. So, skin, hormones, overall fatigue. People don't understand how the gut has a lot to do with fatigue just because of how those little microorganisms are helping you to create hormones and neurotransmitters. Serotonin is a huge part of what's being created in the gut. Serotonin is our, mood regulator. So there's so many of these hormones that are it's not just regulated, but they're even dysregulated because of gut issues.
What do women need to be aware of with toxin exposures?
There are quite a few toxins in the world right now, just not just America, although I would say that America probably has quite a few more. As a physician, I do tend to ask my patients, what do they put on their bodies? What are they eating? Are you comfortable in your home? Is it mold free? There's people who've had wet basements or roofs that have leaked, so there might be some mold issues. So we look at everything from environmental toxins to food toxins. Even peanuts have a very toxic mold on them, so that's a food though, right? It's still mold, but it's a food versus what you're breathing in. So what you're breathing in, what you're putting onto your body, what you're eating there's potential toxins in all of those aspects. So we try to minimize where we can by offering women, here's another option to conventional skin moisturizers that might have, parabens, and there's probably 100 plus chemicals in female skincare products. There's so much out there that we just take for granted because we were told that's going to help firm our skin and plump our lips, and we don't even think about the nature of what's going into those. So, and I'm, not opposed to, every once in a while you want to look beautiful and maybe you want to plump up your lips and do something that's not so natural. But on your everyday life, you should be looking at what you're putting onto your skin and what you're putting into your body and what you're breathing. That's why people have been looking at, purified water filters and getting home air purifiers for the air quality and looking at not cooking in plastics, Don't cook in plastics, don't heat up in plastics, don't freeze in plastics, don't keep your food in plastics. So there's lots of opportunities for women to even just a little bit to reduce their toxin load, even by a little bit. Because what people don't, I think nowadays we've been hearing more and more as women that a lot of these toxins are actually hormone disruptors. We call them endocrine disruptors. And as an endocrine disruptor, what that means is that it literally does change what is going on with your hormones. It can either increase your estrogens, decrease your adrenals, increase testosterones. There's lots of disruption going on. And as we've been talking about hormone balance, if you've got endocrine disruptors, then you've got to rebalance what those have done to the body, toxic-wise. We call it environmental medicine, but really, as I said, it's not just environmental, it's everything that can be toxins, really. It's something to think about. I try not to overthink about it because then no one wants to put anything in their body and no one wants to put anything in their mouths, and everything is toxic around us. So, I'm laughing, but it's a thought that we have to say, listen, everything in moderation, because again, you're just going to be more anxious about it. You're just not going to want to eat anything. You're not going to want to ever, do anything with your hair or face. And I think that, again, everything in moderation, and then realizing that if I'm putting something toxic in my body, let's work with detoxifying the body on a more regular basis. So maybe looking at your methylation because methylation is such a huge part of detoxification, or maybe look at, doing liver cleanses or doing fasting, every once in a while so that you feel comfortable with the fact that it's okay if I have a little bit extra toxins going in there, even if it's in the form of alcohol or whatever your vices might be. But if you know how to detoxify, then you can find that balance. Because people always do ask, especially being a naturopathic physician, the question always comes to, well, what is balance, right? And again, it goes back to that question, what is normal? It's very subjective. But what I always tend to tell people, and it goes back to the philosophy of what I learned back in naturopathic medical school, is that the balance isn't just in one part of your body. It's your body, it's your mind, it's your spirit. So you've got that triangle of balance that needs to happen. You have to find the body, mind, and spirit equal, working together equally in balance to really find balance, right? So I went to a high school where our motto was mens sana and corpore sano, which is a healthy mind and a healthy body. And that is really how I have run my life since high school. Like, that motto has stuck with me forever to this day. And then we've added that spirit in there too, because I think that everyone needs to find whatever faith or belief they need to find that higher spirit of self, right? And so the body, mind, and spirit are where you're going to find the best balance.
What do you do to help women feel comfortable with and in their skin?
Overall health, and I think about how, as a woman, our hair and our skin are how we epitomize health, right? And our weight, too, going back to, weight, we feel comfortable or not feel comfortable based upon if we're happy with our weight. And I think that the importance is that it's, again, not just one thing that goes into that big picture of, healthy skin, healthy body. We have to look at everything we can maximize and optimize. Let's look at your lifestyle. Let's look at your stress, at your exercise. Do you want to tone up your muscles? Do you want to tone down your muscles? When I was huge and a competitive athlete, I was just a ton of muscles, and I hated that look. So I had to, when I figured out how to tone down my body, that made me feel more comfortable. So we want to figure out what makes that woman feel comfortable. Is it her skin? And is she not comfortable with her skin because maybe she has acne or pockets from past acne, erosions? So what are you not comfortable with, and what can I help you do based upon your discomfort? And then look at the big picture of nutrition, diet, nutrition. Let's look at the gut health, the whole microbiome, and a lot of these bacteria are very important to skin. As I told you about my own immune disease that created from my own gut, I lost hair, which affected my physical image, my body image. So nutrition is important, your gut's important, your hormones are important, the balance of your hormones, which actually help with the suppleness of your skin, the elasticity of your skin. But it's really not even just hormones, right? There's collagen, there's MSM, there's other amino acids that go into what makes the skin look healthy and what makes the hair look healthy. Hair is just dead cells. Really, it's just dead cells. So the fact that we're so, the fact that I was in tears when I lost my hair, it's kind of silly, but that's what our skin and our hair and our body is what gives us our own personal self-image esteem. So when you lose parts of it, or when you're feeling like you have bad acne or you have under eye bags or wrinkles, you don't feel so good about yourself, right? So if we can find the ways that you're feeling discomfortable, uncomfortable, in disbalance, let's help you to then optimize by doing, the best nutrition, the best lifestyle modifications and changes and hormone balances for you, patient-centered.
What foods and nutrients are important for skin?
So I'm a cook, a chef. I love cooking. I love food. It could be raw, it could be cooked. I love berries for skin. Vinpocetine from the blueberries, really great. There's lots of antioxidants and lots of foods. You've got your pomegranates. There's even, a lot of skincare out there is utilizing the vitamin C's from different botanicals and from different food sources to help with the nutrition of the vitamin C in the skin. Collagen is really important for skin. Hyaluronic acid is important for skin. And you can get these both, in topical forms and also nutrient forms too. So I think that, again, back to the idea of the best way to dose people or optimize what's going on may be different for the individual. I love foods that are going to kind of help big picture immune system health, because I think that the immune system health also helps your skin and your hair, clearly, coming from someone who, knows.
Where do you think real beauty comes from?
Real beauty, everyone's going to say that it comes from within, and I don't disagree, but I think it comes from having a balance in the body, in the mind, and in the spirit. So I truly, as naturopathic doctors, we were just ingrained to understand that philosophy. The body, the mind, and the spirit have to be in balance to really have beauty, inside and outside. If you're not feeling good inside, you're not going to present it well on the outside. If you're not feeling good on the outside, you're going to have some probably harm inside. If you're not in your full realm of understanding whatever faith and belief and higher spirit for you, you're going to feel probably a little bit more insecure. So I think beauty comes from having that balance of the body, the mind, and the spirit.
When did you realize you are beautiful?
I think when we think of ourselves, we may never really think that we're beautiful. As women, we constantly compare ourselves to others. And sometimes it even comes from our own families. Your mother's telling you that you're fat. Your father's telling you you're not strong enough. So you have to sometimes embrace beauty within yourself and figure out what makes you feel beautiful. I think for me, it does help when people say, you're amazing at what you do. And that makes me feel beautiful. Because sometimes you don't always love the outside of your body. And sometimes the inside of your body isn't working well. But that's okay. Because if you still feel confident in the fact that you are good at whatever it might be, good at, for me, I love what I do. I'm a doctor, and I know that I'm touching people's lives. I know that I'm helping women find a better path for themselves. I feel good about that aspect of me, and that makes me feel beautiful. I love my job. I might not love my body, but I love who I am, and I love what I do. And that gives me the strength to even want to do better and be better. From this world that we live in, we constantly are being bombarded by social media that tells us you're not as beautiful as the next. You're not as skinny as the next. Your hair isn't as long as the next, or whatever it might be. So you've got to find what makes you feel good about yourself so that you can even go to that next goal of losing weight, right? Of that next goal of finding hormonal balance, that next goal of finding better immune system health. You've got to start small sometimes, and that's okay. Do it by finding look into your inner self and find that just one thing maybe that makes you feel beautiful and strong and confident. And we're going to roll with that. We're going to move that into the next level of helping you to find your best optimized health. And that is got to be a good starting place for everyone.
How can women tap into their superpowers?
I think as women, there's parts as we cycle, right? And even if you're post-menopausal where you're not knowing that you have a cycle anymore, you have a cycle. I mean, really, there's women in the menopausal realm who still say to me, I can tell that this is when I would be ovulating. But I also think that there's women that have no idea. They have no intuitive realm to understand their body because they don't feel anything, right? There's women who say, I can feel my ovaries when I'm ovulating. I can taste when I have more progesterone. It's not, we teach women how to take their body temperatures and track their ovulation cycles. Now there's apps for that, right? Now, I talk about social media. I'm old school, so I'm not high in the social media, but there's apps for everything now. And there's apps that track your cycle for you, which is really helpful. And if you aren't as intuitive with your own cycle, that might be what you need to do. But the other aspect is, how do you feel during your cycle? So maybe don't just use that app of tracking your blood flow or tracking your ovulation or tracking your high progesterone or estrogen. Track how you feel during that cycle. And that's where you can really engage in, oh, I feel awesome on day 15. I'm ovulating, I feel awesome. Or is it that you're ovulating and you have cramps because you're ovulating? So then okay, I have to take care of myself on those days because I don't feel so well. So we have to learn how to see within ourselves, whether or not it's from an app for that or, tracking your own body by writing it down in a journal. Some people really love journaling. Some people are just putting memos in their phone, whatever is good for you. But learning about how you feel during your cycle might help you engage in figuring out that superpower of this is my good day. I'm going to get up there and, run a marathon and some people actually do. I'm a racer, I sail. It's not just about the wins. The wins are the really, really important. But if you don't have your all the crew that in the right job at the right place and time, not about just the wind. It's about how that boat moves with the crew in the wind, on the water. And same thing with your body. You might have all your hormones in a balance, but if you don't have your mind working together with those hormones and understanding how you can flow and ebb and flow as we do in a cycle, it's ebb and flow, just like the water and the wind. And so if we can work in a team, in our own bodies, right? Work in that balance of a team, playing together, ebbing and flowing together, and understanding how that cycle works, we're going to be able to optimize those good days and then make sure that you take care of yourself, the self-care that you need for those bad days, whatever those days might be for you. And it might be seasonal for you too. I have a few patients, including even a family member, who her personality changes with seasons, for sure. I can say I'm staying away from her, during the fall. That's just not her season. And that is also potentially due to cyclical hormones and how the hormones play in the body. So understanding how you feel, and this goes back to maybe journaling or using an app or something, but seeing what is the best time for you. I'm a June baby. I just had my birthday. I just turned 49, and June is my month. I feel incredible during June, and I know that nothing can stop me during June. And then July is pretty good. And then the fall hits and it's I'm feeling kind of miserable. And then I see how I bleed, and my bleeding will change even during different seasons too. So those are things that you potentially could track, and think about.
If you enjoyed this episode of the Woman's Doctor podcast, be sure to share it with the women in your life and rate and review the show. And to learn all about balancing your hormones, join us for the Hormones, Health, and Harmony 9-part documentary series at hormoneseries.com.